Hello, everyone, and welcome to Israel Healthcare Highlights, where we share important information about Israeli healthcare with English-speaking audiences around the world. My special guest today is Professor Nadav Davidovitch of the Ben-Gurion University of the Negev, and we're going to hear from him about a very special effort between Israeli healthcare, the World Health Organization, and the Palestinians to prevent a polio outbreak in Gaza. But before we hear about that effort, please, Nadav, tell everybody a bit about yourself.
Thanks a lot, Bruce, and thank you for having me here in your important effort. So my name is Nadav Davidovitch. I'm a public health physician with a PhD in sociology of health. I'm the founder of the School of Public Health at Ben-Gurion University. I was the chair of the Israeli Public Health Physician Association, also serving on different committees, both in Israel, such as on reducing health inequalities, and also executive board member of the Association of Schools of Public Health in European region. So health inequities, I guess it's probably one of my main interests regarding many things I'm doing.
Terrific. Okay, so now tell us about the challenge that was faced in Gaza regarding polio and what the groups did to minimize this risk.
So before speaking about this specific event, we must understand that in the past, including in Israel, polio was one of the most devastating diseases, killing children mainly. Also, we know about polio paralysis, a very heavy burden, especially here in Israel after the establishment of the country. We had thousands and thousands of infected and paralyzed children, some of them still living among us. Then we had the development of polio vaccines. And without entering too much into the different vaccine, it is important to understand that since their introduction, there was a very large reduction of polio around the globe, including in Israel. And in 1988, the World Health Organization decided to have polio as the second disease to be eradicated. And since then, around the globe, there was a reduction of about 99% of polio cases. And now we are in the final stages. And in recent years, we're facing very, very important challenges, including here. We had in Israel 10 years ago, 12 years ago, an outbreak of polio with a vaccination campaign that was successful. And what is interesting that most of the cases actually now are deriving from the polio vaccine itself that can sometimes mutate the oral polio vaccine.
Okay, so maybe just wrap up the introduction a little bit and let's move on to the specifics.
So in recent years, we have a vaccine-derived polio being circulating. Israel and other countries that are doing sewage sampling, and sometimes we can find these vaccine-derived polio, even if there's still no clinical cases. And last year, we started to see both in Israel and in Palestine vaccine-derived polio. If I can share the screen
Please.
here, so we can see the timeline of what happened. We see that in July 2024, there was a confirmation in sewage sample from Gaza. By the way, the samples were also sent to Israel to be analyzed, meaning that already there is an ongoing collaboration between us and Palestinian. And then later in July, the WHO urged a ceasefire to facilitate polio vaccination in Gaza. There was a preliminary agreement decided by the WHO, and in September 1st, together Israel and WHO and Palestinians succeeded to have a ceasefire local ceasefires in order to have a polio vaccination campaign. We can see here how many actors were involved from the UN, from WHO, UNICEF, U.S. Department of State, also from WHO in the Palestinian territories. And I think this is a great example how we can finally working together, even in a state of war, in order to eliminate such an important public health threat.
Very important, very important. Please clarify, what was the role of the WHO in this? What was the role of Palestinians, and what was the role of Israel?
So WHO is coordinating all the global efforts, and when there is a case of polio, this must be it should be reported to the WHO. When there are such cases, WHO committee is being in touch with the local public health authorities. And in this case, as I said, in terms of collecting the samples, that of course this was taken in Gaza. Samples were transmitted both to the WHO and Israel and being tested. And later on, within Israel, there were different discussions how to collaborate, different interventions, including for Israeli soldiers, and also helping Palestinians finally to get the vaccine. We're talking about a novel OPV vaccine that finally created the option to eliminate this outbreak. And I think this is a very important message when we can do collaboration.
So how many people were vaccinated? What proportion of the population, and who was actually doing the vaccinating?
So the vaccination campaign was a collaboration between WHO, the UN, and UNICEF. We're talking mainly about children. We're talking also about 3 waves of vaccination. We're talking about hundreds of thousands of children that were vaccinated. And without coordination and the local ceasefire, this was actually impossible. It is important to mention that the public health community in Israel was also very active in creating and having a pressure to see that this is actually going to happen. I want to share here another slide so you can see here, apart from the discussion we had during the different meetings here in Israel. We also went to the media. This is together with some of my colleagues from the different schools of public health. And you can see here that we said that in order to have an effective campaign as public health professionals, we called for a local ceasefire to stop the spread. And we all understand that, of course, there is lots of political interest here, but this was very successful. And finally, both from a moral point of view and also from the utilitarian perspective, that we didn't want that the polio will finally also entering Israel, this was a very successful. In our discussion, we also wanted to think why a vertical intervention such as polio was successful and how we can replicate this for other interventions that we call them horizontal interventions. And indeed, throughout the war, the public health community in Israel was in touch with colleagues from Palestine, both in the West Bank and Gaza, in order to improve, for example, the humanitarian condition, to improve food security. And I think this had also its important influence. And we shared solidarity with our colleagues in Palestine that we're working with them for many, many years on different platforms, and also working together on international platforms such as the World Health Organization, Association Schools of Public Health European region. And this is why it's so important that we continue to work with them.
Nadav, that's a very important story. What I take away from it is this very special role of Israel's public health community in finding ways to work together with Palestinians and others and international agencies, even in times of conflict and tension. I know that you've been a very important part of that. So many thanks to you and your colleagues, both for the interview, but also for the very important ongoing work that you're doing. And I hope that in the months and years ahead, we'll see even more cooperation for the benefit of everybody in the region. Nadav, thank you so much.
Thanks a lot, and let's hope for the fast return of the hostages. And war are not good for public health. Let's hope for some way that we'll move forward and get away from the trauma that is so profound here in Israel and other places.
Thank you. Thank you so much.